this is the patient burden of moderate to severe atopic dermatitis. And so basically the article first highlights that although eczema is most prevalent in children, that adult onset of the disease is still possible, and that atopic dermatitis or eczema is a chronic lifelong condition for many patients. The health and the social aspects of the burden of atopic dermatitis has been well characterized in children, but not adults. In adults, the burden is mainly affected by other diseases that come from having atopic dermatitis, like asthma and allergies, and also the effects of constant itching on sleep schedules and functioning like daily. This, along with negative mental consequences such as depression and anxiety and so on, and also reduced health quality of life. Although the importance of understanding this burden is recognized, there is not enough information on the patient burden of adults from moderate to severe atopic dermatitis. Methods. So the data were from a multinational clinical trial of an antibody that targets and reduces symptoms of atopic dermatitis, but it was mainly based on the screenings before. So the patients required were 18 years or older and had had eczema for 3 years or longer. An eczema severity index was used to find the standards for moderate to severe atopic dermatitis, with 3 being moderate and 4 being severe. The analysis of the disease, like I said before, were based on the data collected before the study, interventions with the antibody. They used scales for itch and sleep assessment over the 3 previous days before the screening, and the generic hospital like anxiety and depression scale was used to generate an overall health index. And descriptive statistics were used throughout the whole study. Results. So the majority of the people reported experiencing itch every day of the week and frequent bleeding, flaking, and drying of their skin. This itching in turn impacted their reported sleep because it delayed their sleep or woke them up in the middle of the night. Anxiety symptoms were more common than depressive symptoms. The total score correlated with a very large impact on patients' lives. It showed that majority of the patients reported embarrassment or self-consciousness about their appearance because of the skin disease, and also the interference of this disease in their relationships and work or school. Basically, in essence, the results of this analysis gives insight into the different elements of the burden of atopic dermatitis and how it has negative impacts on mental and physical functionings, which reduces activity and health quality of life. And this connects with my topic because I talk about health quality of life before I get into the specifics.